So type 2 diabetes is probably the commonest endocrine disease in the world. It accounts for about 80 to 90% of diabetes around the world, and it's exploding in incidence. And it's due to insulin resistance. Hello, I'm Dr. Soji Swaraj. I'm a consultant physician and endocrinologist. So we look at people with hormonal issues, diabetes, thyroid, but I have a particular interest in metabolic syndrome and women with polycystic ovarian syndrome. The fundamental issue is if people are born with insulin resistance, your pancreas has to compensate by pumping out more insulin to do the same job because it's not working well. And at some point, if the pancreas fails to pump out enough insulin, the glucose won't be able to get into the cells, the glucose levels in the blood goes up, and that's type 2 diabetes. Sometimes it happens temporarily when a woman's very insulin resistant in pregnancy. We call that gestational diabetes. Type 1 diabetes is very different. It accounts for about under 10% of diabetes around the world, so still a lot, but it occurs when your immune system, responding to something in the environment, could be an infection, we're not entirely sure, but your immune system produces antibodies that destroy the islet cells of the pancreas. They're the cells that produce your insulin. So there's a progressive destruction, so the person has no insulin on board. That's called type 1 diabetes, and those people need to have insulin from day one. The types of symptoms people might present with when they have diabetes, whether it's type 1 or type 2, are the symptoms of hyperglycemia or high glucose. So by the time your glucose levels are particularly high, say a normal person's glucose levels never go above 6.6. But if people's glucose levels are going above 10, they'll often start to get dry mouth, blurred vision, excessive urination, excessive thirst, and that's when they typically present to their GP and found to have a high blood glucose and they get diagnosed. One of the problems is there's a lot of people in the community with diabetes who don't know they have it because their glucose levels are elevated but not high enough to give them symptoms. Hence why we promote screening in the population. If about 7% of Australians have got diabetes, well then it's worthwhile having an annual health check and having a fasting glucose checked. When they have a lot of weight loss through lifestyle intervention or through surgery, such as the sleeve gastrectomy or bypass, they'll often reverse their insulin resistance so significantly that they no longer require medication for their diabetes. And they'll often consider that as a reversal of diabetes, and it's a fantastic achievement to come off your medications. We see a lot of people after surgery coming off their insulin, sometimes their tablets. But the genetic issue of insulin resistance remains. So these people still need to be doing resistance and aerobic exercise. So the so-called reversal is only going to be temporary if these people aren't doing the gym work, the resistance, the aerobic exercise, and attesting to their diet. If diabetes type 1 or type 2 is left untreated, the complications of the high blood glucose include what we call macrovascular complications such as heart attacks, strokes, kidney failure, loss of feet, and the microvasculars, the small vessels, which include bleeding at the back of the eyes, so loss of vision, peripheral neuropathy, so nerve damage, numbness, tingling, and loss of erections in males, which can be debilitating for those middle-aged men.